Yields back. For what purpose does the gentlewoman from Georgia, Ms. McBath, seek recognition?
Madam Chair, I move to strike the last word.
The gentlewoman's recognized for 5 minutes.
Thank you, Chairwoman Fox, Ranking Member Scott, and to your staff for making today's bipartisan health care markup possible. As I have shared to this committee before, I have personally survived 2 different bouts of breast cancer, and I am also the daughter of 2 healthcare providers. I've seen this industry as a patient, but also from a provider's perspective, and I know that there's so much that we can do together to ensure that every American has access to the care that they need, when they need it, and at a price that they can afford and that their families can afford. Healthcare is very personal to me, and it's so important that we get this right for the folks that are counting on us back in our home districts. And I thank the chair for hosting today's markup to bring more transparency to the healthcare space and lower prices for everyday Americans. A similar topic that is also important to patients and providers is streamlining insurance-mandated step therapy. Under current law, patients in certain situations are required to try and fail other medications before being able to take advantage of the treatment that has been recommended by their doctor. And I'm just going to take a point of privilege to say that my husband's going through that right now. He is undergoing treatment, and we're trying to figure out what medications really work for him. The medications that he's on right now are actually failing him. And so while we're going through this process, we are right now doing the very thing that we're talking about at this moment. This one-size-fits-all approach causes unnecessary delays in care and also exposes patients to expensive and possibly dangerous medications that their doctors have not recommended for their treatment. Our bill, the Safe Step Act, would actually streamline this system by requiring insurance companies to have a clear and rapid process to allow coverage for the medication or treatment that is best for the patient as prescribed by their doctors without having to try other medications beforehand. This bill will have a tangible and positive impact on patients while also taking steps to reduce wasteful spending on drugs that doctors say will not solve the medical issues that they are intended to solve. I appreciate all the hard work and feedback from the chairwoman and her team on the Safe Step Act. And I look forward to working with you, Representative Chavez-DeRemer, both of us working as hard as we can to get this important bill signed into law, and I yield back.